Morning, students.
Good morning, sir.
Can you hear me? Is it clear?
Yes,
Yes,
sir.
sir.
All right. Nice to meet you again after a long time, isn't it? I think I took a class in the first week of the month, and this is the last week of the month. And today we are. Is there in the slide? I guess you can see the slide. Can you see the slide?
Yes, sir.
Okay, good. So the topic today is deep sea diving physiology. Okay. You must have other students, other teachers must have discussed with you high altitude physiology. Has it been done? High
Yes, sir. It
altitude
has been done.
physiology. All right, deep sea. You know what is deep sea, no? When a depth is when the depth is say more than 30 feet, 33 feet, let's say, okay, where the atmosphere doubles, okay. So more than that, it'll be, we're going into a deep sea, okay. So diving in the ocean or when the depth is large, okay. So that would be deep sea diving, okay. So it's not something like you're swimming in a pool, in a garden pool or any pool for swimming pool. That it's not going to produce any alteration in the physiology. But when you go deep into the sea, diving deep into the sea, then you will be, encountering some changes in the physiology. Now you have discussed high altitude, and you've seen that with, the rise in the altitude, you also see a fall in the barometric pressure. Now the changes that you see in the physiology is basically because of the changes in the pressure, atmospheric pressure. So, that's why you see all those changes in the acclimatization, and the other changes that you see in high altitude. So similarly, you're going to see something that is happening to the body when you go deep into the sea. All right. So as you dive deep, pressure, the atmospheric pressure is going to increase. Okay. So we have a slide here. All right. So you can see here, that's the difference between the deep sea diving and high altitude. Barometric pressure increasing with deep sea. As you go down into the sea, all right, as you go up into the altitudes, you find that pressure decreases. And because of this, you will find that the volume of gases gets compressed in deep sea and it expand in high altitude. And that is going to have an effect on the intrathoracic pressure, intraocular pressure. So the main, the system that is directly affected by the changes in the atmospheric pressure will be first and foremost the lung. Okay, so the pressure on the chest, and for that matter, any air-containing cavities. So the compression, as you go deep into the sea, we experience a compression that is felt on the chest and on the abdomen. So the pressure on the outside, which is very high, is going to compress the air inside the abdomen or in the lungs. Okay, and that would result in the rise in the pressure. Okay, so rise of the intrathoracic pressure as well as intraocular pressure, because you have to exert more pressure to breathe to overcome the outside pressure. Clear? So now you can see here, this is a problem as you go deep into this, depth of the sea, at a level of 33 feet, okay, sea level of 33 feet, you will find that the atmospheric pressure doubles. So normal sea level atmospheric pressure is 760 millimeters of mercury. But at 33 feet, it will be twice that. So 2 times 760 millimeters of mercury. Okay, as you go deeper, so for every 33 feet, there will be an increase in the atmospheric pressure by 1. All right. So at 66, it will be 3 atmospheric pressure. At 100, it will be 4 atmospheric pressure, and so on and so forth. Okay, so that list is there, and it's there in your book as well. So you can go to Guyton and you make a reference. Okay, now that is why we're going to see changes in the body, because there will be changes that is occurring in the lungs. All right, and what happens is in the lung, you can see in the just the diagram below, you have that air is kind of a gas chamber. All right, and at sea level, you'll find that the gas in the chamber, it's 1 liter, but sorry, pointers there? No. Okay. All right, we don't have a pointer, so you may have to just follow what I say. So as you go, by 33 feet, you go down by 33 feet, there will be a change in the atmospheric pressure by 1. So it's going to increase by 1. And when the pressure increases by, say, by another atmospheric pressure, say by 2 times 760 millimeters of mercury, you'll find that the volume of the gas also will reduce. It's going to be half that. All right, so half a liter. 1 liter will become half a liter. Now this is, in compliance to a law, what we call as a Boyle's law. Okay, and I think all of you are aware of this law, where the volume is inversely proportionate to the pressure, or the pressure is indirectly proportionate to the pressure. Okay, so pressure is directly proportional to the volume. Sorry. So as you go down, you'll find pressure increases and volume reduces. All right, so you become denser and denser as you go down. Okay, the air becomes compressed. The volume is because the volume reduction is because the air is being compressed. Understand? So when it's compressed, it becomes denser. Clear? So this is what we see as we go into the depth of the sea. Okay. Now, for people, involved in some kind of activities in the deep sea, some people do works in the deep sea, and people especially involved with marine biology or some kind of marine work, or like the navies for that matter, who are in defense, they will be, doing some work that they will be exposed to deep sea. And the effects, physiological effects in deep sea, all right, when people have been working for a long time in deep sea, say more than an hour, okay, they will start experiencing more than an hour and at a depth of more than, say, at a depth of more than 100 feet or 120 feet, where you experience the first, the first features of, or a mild feature of narcosis. Okay, so these are basically the physiological effects. One is that there will be nitrogen narcosis at high nitrogen pressure. 2 is that there will be oxygen toxicity at high pressures. And third, which probably is not really an effect, except that you are exposed to a very high pressure for a very long time, and also when you're using types of apparatuses for diving, that increases the dead space volume, then this may have an effect. Okay, so anyway, we come to nitrogen narcosis at high pressure. So as we said, all these gases, the pressure increases because of compression, and so nitrogen also will be, they'll be breathing, they will have to, breathe, the air that they're breathing will be at high pressure. All right, The breathing of high nitrogen pressure, you know that nitrogen in the air that we breathe is somewhere around, say, 80, more than 80% or 80%, isn't it? So nitrogen at high pressure, at sea level, when it's at normal pressure, nitrogen doesn't have any effect on the body. All right, it's only when the pressure is high and a person is exposed to this high pressure for a period of more than an hour, then that you will see the features of nitrogen narcosis. So at a depth of 120 millimeters, at depth of 120 feet, okay, at a depth of 120 feet, if one is working for an hour, then he will start experiencing some kind of, nitrogen narcosis. It's a mild form of narcosis. A person becomes jovial in nature, euphoric, and he loses all his cares, or what we call a sense of inhibition. Okay, so that is one. That will be the first feature that a person will be experiencing, and sometimes, because of this euphoric nature of this feature, it is also called as the rapture of the deep sea. Okay, so rapture of the depth. Okay, and as one goes down deeper into the sea, all right, say at 150 to 200, then one will experience other features as well. And these are features that affects the nervous system. Person becomes nausea, and he gets nausea, so nauseating, or dizzy, all right, dizziness, so there'll be dizziness, nausea, and vision will be affected. So irritability. Okay, so some of these, these are basically central nervous system features. Then if one goes deeper, say to 200, between 200 and 250 feet down the sea, then the person will, become clumsy when he does work. All right, he'll become lethargic, and then the performance of work will be very clumsy. So it becomes difficult for him to do work. And beyond 250, a person is almost useless. Something like, experiencing something like when a person is put in anesthetics, all right, under anesthetics, all right. So some of these features of nitrogen narcosis, they, resemble and, the effects of alcohol, all right. So something like, one is drunk with alcohol, that you get some of the features that are similar to nitrogen narcosis. Okay. So why this is happening is, the reason is because nitrogen at high pressure, it dissolves in tissues. All right. Nitrogen is not used, unlike oxygen, which is utilized, metabolized. So then eventually it will be produced into carbon dioxide. Okay. But nitrogen is not being utilized or metabolized by the body, and so it accumulates. And another thing is that it has a tendency to get dissolved. It dissolves in the fluid of the body. It dissolves in the tissues of the body, and a tendency to dissolve in the fatty acids. All right, fat tissues, and especially the fat tissues in the nerves, all right, affecting, so it will be affecting the nerves, and this will, have an impact on an adverse impact on the cell membrane, all right, and that would affect the excitability of the membrane, all right, and This is how, this is how the features of central nervous systems are caused. Okay, so the membrane becomes useless as an excitable tissue. All right, so and this is because of nitrogen. We call it nitrogen dissolution in the tissue, in the fluid of the body. All right, and another thing is the oxygen toxicity at high pressures. I'll come later what happens, when this is what is happening in the depth of these, the depth of the sea. All right. And I'll explain then what happens when you, suddenly come up from the depth of the sea to the sea level. That'll be later. Right now we are talking about the effect of the increased pressure of the gases on the tissue. Now the other effect is the oxygen toxicity at high pressures. Now to understand this, we probably have to look at this figure. Okay. Now you can see there are three curves. Actually, there are four curves here. The blue curve is reference of the total oxygen in the blood. All right. The red refers to the combined, oxygen, hemoglobin. All right. And the green curve is the concentration of oxygen in a dissolved form. Okay. And of course, the gray, as a gray line, as a normal, represents the normal alveolar oxygen pressure. Okay. So what happens when you go into the deep sea? Pressure increases, and because the barometric pressure increases, that would have an effect on the alveolar pressure as well. There will be increased alveolar pressure and increased diffusion as a result of this into the blood compartment, and there also pressure of oxygen will rise. Okay, because the amount of oxygen that will be dissolved will be also rising. As you can see, the green curve there, there's a linear rise. Okay, of the amount of, or the volume of oxygen in terms of percentage with respect to the oxygen partial pressures in the lungs. Okay, that means with respect to the alveolar oxygen pressure. Okay, and another thing is that you will see also that the content, all right, of oxygen, of course, rises. The oxygen hemoglobin combination will reach a steady state at a point, say at around 120, when the oxygen partial pressure is, say, 120 millimeters of mercury. All right, so it reaches a steady state, and you look at the volume, the volume of oxygen hemoglobin, all right, will be somewhere around 20 volumes percent. Okay, but the amount of dissolved oxygen will be somewhere around 10. See, it rises steadily, and at a pressure of 3,000, which is, I think, somewhere around how many atmospheric pressure? 1, 2, 3, 4, say around 4, 5, between 4 and 5 atmospheric pressure. Okay. The content will be somewhere around 10 volumes per percent. Okay. And we already know the oxygen content in the blood and how oxygen is utilized by the cells. Let's say if normally we know that the amount of oxygen that is utilized by the body is somewhere around 5 ml per 100 ml, we say. Okay, that is at normal when we're talking about a condition which is at normal pressure. Okay, so when you look at the blue curve, the amount of blood that is being transfused, or that diffuses from the blood compartment into the tissue, which is 5 ml, will be under very high pressure. You look, the point A there, the pressure is around 3000 millimeters of mercury, and there's a point B in the blue curve, all right, which which is equivalent to, see, when you look at A, it's equivalent to 30, say somewhere around 28, say 28 volumes percent. When you look at B, point B in the blue curve, it will be somewhere around 24 or 23, I think 23 volume percent. All right, so somewhere around say 5, that is equivalent to 5 ml, that or 5 volume percent, that the body, that the oxygen diffuses into the tissue. Okay, so but then this is occurring at very, very high pressure. The point B is which should be equivalent to 40 millimeters of mercury in tissue at normal atmosphere. All right, but here high atmosphere, you'll find that the pressure that is responsible for the diffusion into the tissue is around 14, say 12 to 1400 millimeters of mercury. Okay, so we can see from this graph, we can see that we're seeing some changes. All right, not only in terms of the amount of oxygen that is dissolved in the blood, but then how oxygen is being utilized at high pressure, and we are also seeing the content of, the pressure in the alveolar space, which is rising with increased pressure, with increased depth. All right, so what can we actually infer from this? See, a number of things can be inferred from this, and that is at great depths, the oxygen dissolved in the blood increases. Okay, and people are breathing at a very high pressure, and so the diffusion of gas is occurring at a very, very high pressure, and this is going to have an effect on the tissue. All right, it's going to have an effect on the tissue, and it can most importantly affecting the brain and the pulmonary system, and we can have features as a result of this, which is called as an oxygen toxicity, a condition that is called as an oxygen toxicity. So the pulmonary effects can be burning sensation on taking deep breath, can be cough, edema, pneumonia, all right, or it can result in permanent lung damage. So one thing is that with increased depth, you will find that it will be affecting the lining of the oxygen will be affecting the lining. Oxygen at high pressure will be affecting the lining of the the bronchi, and be affecting the alveoli. Sometimes it will result into atelectasis also. All right, and all these together would result in a permanent lung damage. Okay, central nervous system effects will be something like muscular twitch. The things that I've already told you earlier also, something like nausea, something like dizziness, vomiting, muscular twitching, and then affecting the vision as well as hearing. All right, then we other symptoms like anxiety, confusion, irritability, and seizure. So you put a person at, at a very high pressure of, say, even more than, say, more than 4 atmosphere for a period of, even for a period of 30 minutes, a person would have these experiences like seizure. All right, and this can be very lethal for a person who's diving, and sometimes he may go into coma as well. Okay, so one is submerged in water and is having all these, physiological effects that can be lethal. All right, so these are the findings that, have been documented after a very long period of, study. So these are effects of, oxygen toxicity. Another thing that I would like to mention about, oxygen toxicity is that it also has an effect on the production of free radicals. The more the pressure, the more will be the, amount of free radicals that will be produced. Okay. So even when you breathe normally also, at normal pressure at sea level, there is production of free radicals in the form of peroxide, hydrogen peroxide, or the peroxide like hydrogen peroxide. But the thing is that these are being neutralized by the an enzyme system, all right, that we call as the antioxidants, something like the peroxidases, catalases, okay, superoxide dismutase. These are the, enzyme, or let's say an enzyme system. When you take them together as one, it's an enzyme system that will, neutralize the production of oxidants. And oxidants, they can destroy, they can destroy and disrupt the function of the tissues. Okay. And so it's important to, always important to neutralize the oxidants that is being produced with respiration. So at high pressure in deep sea, all right, the production of these oxygen will be high. All right, so high, and it overwhelms the enzyme system that is responsible in clearing the oxidants. All right. So when the enzyme system becomes overwhelmed, then there will be no control on the rise in the concentration of the oxidant, and the oxidant can be, as they can be lethal and dangerous for the body. So this is also one aspect of oxygen toxicity that we must take into consideration, besides the other things that we have already spoken earlier. Okay. Now, the third effect would be carbon dioxide toxicity. But, depth alone does not increase the rate of carbon dioxide production in the body. And when you are breathing at normal tidal volume, even in deep sea, you are going to expire, all the carbon dioxide that is being formed. All right, and this will still keep the alveolar partial pressure of carbon dioxide at normal. Okay, so it's only when you're using some gears, diving gears or diving helmets, or some type of rebreathing apparatus, where as I've said earlier, the dead space volume of those helmets or those gears and apparatuses is high. All right, then there will be a buildup of carbon dioxide, and even if, but then a buildup of carbon dioxide of, say, double its normal, which is somewhere around 80 millimeters of mercury, that will not be producing some effect. But if the buildup is more than 80 millimeters of mercury, all right, the partial pressure of carbon dioxide, then the respiratory centers, instead of being excited, they will be depressed here. Okay. And other things also will crept in, something like, because of high carbon dioxide concentration that would result in respiratory acidosis. Other things like, of course, carbon dioxide narcosis, lethargy, and even the anesthetic effects that you see as a result of, nitrogen narcosis. So very similar, effects can also be seen as a result of carbon dioxide toxicity. All right. So before we jump into the next point, let us refresh ourselves. So you're going deep into the sea, you will have a change in the barometric pressure. So for every 33 feet, there will be an increase of 1 atmospheric pressure. Okay. So the increase in the barometric pressure would result in the compression of the gases, and compression of the gases would result in the increase in the pressure. All right, and being at high pressure would result in the, nitrogen narcosis, which is 1, and 2 will be oxygen toxicity, and 3 will be carbon dioxide toxicity. So these are the 3 effects, physiological effects. Okay, clear. Now, we come to this condition, which is called as a decompression sickness. The thing is that a person who has been diving for a long period of time, more than an hour, into the depth of the sea, will have to come up, isn't it, into the sea level. You cannot remain there for long, forever. One has to come up. Okay, and the thing is that we are not aquatic, creatures. So we are actually land creatures that, we go down to into the depth of the sea only for a particular purpose. So we need to come up, and coming up from the depth, where we've been exposed to a very high pressure, and where, and if we have worked at the depth for a period of 1 hour or more, there are already some, changes that have taken place in the body that, will produce some kind of effects when you come up, when you immediately come up. Okay. So a rapid ascent, we'd say, a rapid ascent from the depth, all right, would result in the condition that we call as a decompression sickness. Now, this disease is also called as a BEN, sometimes referred to as a Kaisen's disease or diver's disease. Okay, there are many names to it, and this is only actually a very short list. There's a very long list. If you go into probably to other books, you'll find that you have other names for it, but it's normally known as a decompression sickness. Okay. So the very term itself, decompression, is that, it refers to, a condition where a person has compressed, who's gone to the depth and has experienced compression. And, as he rapidly ascends, he, is exposed to a decompression, all right? So, and we have already seen in the earlier slides how the nitrogen is, as a result of compression, how it gets dissolved, all right, in the tissue fluids, in the tissues themselves, all right, and this is the main, reason for the condition called decompression sickness. It's basically because of nitrogen dissolution in the body fluids and body tissues. Okay, so as a person comes up because of decompression, the nitrogen, which is already like it's trapped, or like it's trapped in high concentration in the body tissues and body fluids, all right, that will try to come out, all right, in the form of gas. Okay, so the gas that is being decompressed now is going to expand. It's the expansion of the gas, as a matter of fact, as you rise up from the high pressure to the lower pressure area. Okay, and because of this, there will be formation of what we call as the nitrogen bubbles in the tissue spaces and the bloodstream. Okay, and this would result in, the formation of these bubbles in different places would result in different problems. If you have bubbles, nitrogen bubbles, coming, build up of nitrogen bubbles in the joints and the muscle, and you would have pain in the joints and the muscles, all right, cramps and pains, and the pains in the joints is basically called as the bends, and the name of the disease also, and the other name of the disease also is actually taken from this, all right. And then another thing is that the formation of bubbles as a result of decompression, all right, can result in, say, formation of air, something like it becomes like an air embolism, or the bubbles, they start blocking the veins, the arteries, the blood vessels. Okay, and then sometimes these small bubbles, when they block small capillaries, they can cause tissue, local tissue ischemia and all that, and that also would result in pain in the tissue. But sometimes they coalesce, they form a bigger bubble that blocks bigger blood vessels, and that can lead to a dangerous consequence. Right, if it happens in the brain, then or in the heart, all right, in the heart may cause myocardial infarction, and in the brain may result in stroke. Okay, so this is called as, this is another feature of decompression sickness, the formation of the development of stroke. So one is the bends, which is pain in the joints, and of course the cramps in the muscles and in the limbs, in the torso. Okay, and of course the stroke that can be produced as a result of collection of bubbles, or the bubbles forming a kind of an obstruction in the vascular system. Okay, another thing is that it can the bubbles also can affect the small pulmonary capillaries in the lungs. All right, and because of this, there will be shortness of breath, or something that is called as dyspnea. All right, so it will be affecting the partial pressure of oxygen in the blood, and there will always be the want of more air. All right, and so a person goes into dyspnea. Okay, and the only thing is that the only reason is because of the micro bubbles that are blocking or clogging the pulmonary capillary system. Okay, so this can result in what we call as chokes. So there are three features that you cannot forget when we talk of decompression sickness. One is the bends, two will be the strokes, and three will be the chokes. All right, that you will be seeing in the case of decompression sickness. But the most seen feature will be the bends, because 85 to 90% of people who have this disease, the sickness, decompression sickness, as a result of rapid ascent, they will experience these bends. all right, and only around 10 to 15% will have serious, the serious features of chokes and strokes. Okay. Now, sometimes it can result in numbness, tingling, and paralysis. These paralysis can be temporary. Once a person is treated with recompression, the paralysis may disappear. But sometimes, occasionally, they can be permanent. Okay. So how do we treat a problem like this, decompression? We know that the reason is because of rapid ascent, all right, and one has to be recompressed, put him back into the high pressure, rather, let him go back down into the depth of the sea, or we can, put him in some artificial high pressure hyperbaric chamber, all right, and where the person is, or the diver is recompressed. Okay, and at the same time he is receiving hyperbaric, oxygen administration, which is 100% oxygen. Now this will reverse the pressure, changes that causes the bubbling of gas, all right, and then drive the, bubbles or gas that is being bubbling will begin compressed into a liquid form, and then with a slow decompression, this condition can be treated, can be managed. All right, and now there are. If you go into Guyton, you will find that they have given us some measures by which we can prevent and manage decompression sickness. One is that is the elimination of nitrogen itself from the body by the process of recompression, or one recompression that we have already seen in the earlier slide, or by slow ascension. So we are following pattern that has been adopted by the United States Navy, all right, for many years, and for people who work under high pressure deep sea, all right, they follow this protocol, all right, of slow ascension. Okay, so this is what you see now. Firstly, at the first stage, say from a depth of say a depth of 250 feet, you must come up, all right, say what, 150 feet, all right, a depth of 150 feet. If a person has been working for an hour, he must, adopt this protocol of ascension. Okay, so he should remain 10 minutes at 50 feet depth. He'll come up, all right, and after ascending 50 feet, a person must remain there for a period of 10 minutes, all right, and allow the elimination of nitrogen, okay, through breathing only. So it means the nitrogen that will be coming out from the tissue into the bloodstream, and then that will be eliminated through the respiratory system itself. And this will prevent the bubbling of, nitrogen, and that will be collecting in the different places. Then at 40 feet for 70 minutes, then you ascend again for 30 feet, that will be, you'll be staying there for 19 minutes. Then you ascend again for 20 feet, right, and then 50 minutes, and then the final ascension of 10 feet, you'll have to remain there for a longer period of time. So what do we see here? We're seeing that when a person goes to a depth of 150 feet and stays there for an hour, all right, he's taking more time to come up. So when he comes up, he has to come up 3 hours. It takes time 3 hours for him to come up, and going down and working at the same time, working at the depth of 150 feet will take 1 hour. Okay. So we are taking more time in, more time in the elimination of nitrogen by slow ascension. Okay, so this is one method of eliminating nitrogen from the body when one has gone into depth of 150 feet and has been working there for a period of 1 hour. Another thing is that you have these tanks, as we have already said, you have these tanks where we can recompress. They are called tank decompression and treatment. Okay, so there, a person who's having decompression sickness is put into this tank, is recompressed, and then he's decompressed gradually. Okay, again following some kind of protocol. And the treatment that can be given at the same time will be the administration of hyperbaric oxygen. Okay, and another method is something called saturation diving and use of helium oxygen mixture in deep dives. Now, people who have to work at increased depth, at deep into the, deep sea, all right, they do some kind of, exercises where, they are put into the tank days before the diving. They are sometimes made to experience, or to experience compression. They are put into a compression tanks, and one thing is that by doing that also, saturating the body with enough with gas, that when they go into the depth and they come back for decompression in the tank, the elimination would be even faster. And then helium oxygen mixture also is being used for breathing, because helium, one thing about helium is that it's not like nitrogen. Okay, it is at high pressure. It's not so dense as nitrogen, and it helps. It decreases the density of the air, and therefore decreases the airway resistance while breathing. That is one thing. And second thing is that it doesn't dissolve. It doesn't get dissolved as highly as nitrogen in the body fluid and body tissue. Okay, so it takes less time for it to be eliminated during the period of decompression. So these are ways of managing or preventing decompression sickness. So I think that will be all that I will be discussing today, and I want you to write yourself, or rather read yourself. First you read yourself. I'll be giving a assignment later, but first you read yourself about scuba diving, all right, and how it helps. You give a diagram. You read. There's a diagram in the book, and you go through that, and then see how it's being used, all right, for deep sea diving. Okay, so now what we discussed today is a very important topic. It oftenly comes in examination. Okay, so we have already seen, one is that the physiological effects of deep sea diving, nitrogen narcosis, oxygen toxicity, and carbon dioxide toxicity. And two, we have also discussed about decompression sickness, isn't it? And we know the causes, the bubbles, all right, the collection of the bubbles, all right, causing at various points in the body and all right, tissues, and causing bends, causing strokes, causing chokes. And we have also discussed the prevention and management of decompression sickness. First, by nitrogen elimination of the body, by slow ascent. Two, by using a tank decompression, okay, where a person is recompressed and then decompressed slowly. And of course, treated at the same time, he's treated with the hyperbaric oxygen. Then the third is saturation diving and the use of helium oxygen mixture in deep dives that also would help in the prevention of decompression sickness. I think this is all about today's topic. And I want you to write an assignment on this topic itself. Okay? And please add scuba, all right, scuba diving. Okay? So I'll sign off this class today with this, and thank you for listening. And bye.